Uh, Today is my presentation about can insulin pump technology help exercise in Ramadan? First of all, Assalamu alaikum wa barakatuh. This is my disclosure, and this is the agenda of my talk. I will present about Ramadan fasting and type 1 diabetes, exercise and type 1 diabetes, advanced hybrid closed loop system, and advanced and automated insulin delivery, and active fast study, which we conducted in our center. Regarding Ramadan and type 1 diabetes, it is well known to all of us the risks and benefits associated with Ramadan fasting in diabetes patients, and it is more pronounced in patients with type 1 diabetes, like hypoglycemia, hyperglycemia, DKA, and other complications. Also, there are some benefits, like it is important for better lifestyle, to improve diabetes management, and also mental health, like sense of fulfillment. But let's face the reality. Although the type 1 diabetes patients are exempted from fasting, different surveys found that 43 up to 77% of them, they intend to fast in Ramadan. Regarding exercise and type 1 diabetes, we know the benefits of exercise and different types of exercise recommended for patients with type 1 diabetes. The moderate intensity is vigorous exercise, strength exercise, and of course, exercise has benefits, especially to patients with type 1 diabetes, like increased cardiovascular fitness, sleep, better sleep, glycemic control, mental health, control of weight. But on the other hand, there are risks and barriers for exercise in type 1 diabetes, like the hypoglycemia and the fear of exercise-induced hypoglycemia, exercise-induced hyperglycemia, DKA, and also the knowledge about exercise management. Regarding the advanced hybrid closed loop system, this system had three components. It has CGM, continuous glucose monitoring, which monitors the glucose levels and send it to the insulin pump, which is the second component, delivering insulin to the patient. And the third component is an algorithm. This algorithm is the controller which controls the insulin delivery up and down, or even stop the insulin delivery based on the glucose data coming from CGM. And all data coming from this system will go to the cloud, and from the cloud will go to the healthcare professional to review the patient reports of CGM and of insulin pump settings and everything about the C system. One of these systems is the Minimet 780G Advanced Hybrid Closed Loop System, and this system was studied in Ramadan in adolescents, and it showed safety for adolescents, as you can see in this study from Egypt. In adolescents, it shows safety regarding Ramadan fasting. Also, this system was studied in exercise, either high intensity or moderate intensity, and showed excellent control and safety during exercise, and is a 24-hour after the exercise in both situations. So based on that, we conducted in last Ramadan, 2023, our study. It is the exercise impact on glycemic control during and after Ramadan fasting in adults with type 1 diabetes using Minimet 780G Advanced Hybrid Closed System. We call it active fast study. The background of it, that this system showed benefit in Ramadan, separately in adolescents, and showed benefit and safety also with exercise. So we plan to combine both together in adult patients. And it is known that at the time when we conducted this study, there was no data about exercise and type 1 diabetes during Ramadan. The aim of our study is to assess the impact of aerobic moderate intensity exercise on hypoglycemia risk and the glycemic control in individuals with type 1 diabetes who are interested in Ramadan fasting, and the use of Medtronic Minimet 780G Advanced Hybrid Closed Loop System. The methodology of our study, it was a prospective single-center, single-arm study at the Technology and Diabetes Unit at Hamad Medical Corporation, Qatar. This study was conducted, as I said, last Ramadan and Shawwal, because we compare data in Ramadan versus Shawwal, non-fasting. The inclusion criteria: patients, adult patients who are interested to fast Ramadan, they have type 1 diabetes for more than 1 year with A1C 10 or less, and they are using the system for at least 1 month. We excluded those with type 2, history of DKA or severe hypoglycemia for last 6 months, pregnancy, or advanced diabetes complications. We conducted a pre-Ramadan structured educational program in the 2 weeks before Ramadan. Example of things covered like nutritional plan for the patients, sick day rules, also how to manage the system during how to use the system around exercise. They need to activate the tempo target feature of the system. This raises the target of the system, the glucose level of target of the system to be around 150 to decrease the risk of hypoglycemia during exercise. And this needs to be activated 1.5 hours before starting the exercise and to stop it by the end of exercise. Exercise goes for 30 minutes, so they will keep it, this temp target feature will keep it on for 2 hours. The exercise intervention was an aerobic moderate intensity exercise in the form of brisk walking, more than 100 steps per minute for 30 minutes per day for 5 days per week, as recommended by the ADA. In Ramadan, it should be done during eating hours at night, in Shawwal at any time of the day, because this is non-fasting. And the use of this threshold, the 100 steps per minute, because it has been shown in Theodore Locke et al. That in this review, they found that in different studies, reaching the base of walking more than 100 steps per minute would put any person in moderate intensity exercise level. Of course, we need to monitor the compliance of patients with exercise and use for that an activity detecting device, wearable device, HAWA Band 6. And this was connected to an online platform called the Saha, with this system for integrated health analytics. This system developed locally in Qatar by Hamad bin Khalifa University. And this system will help both the patients themselves to monitor their steps, to know that they are following the instructions, walking more than 100 steps per minute for half an hour, and help us also to monitor the patient activity remotely by an objective way. So this is the system patient using, the insulin pump 780G. This is a wearable device. Data will go through Bluetooth to their mobile phone, to mobile applications on their phones. Then data will be shared to the cloud and then to clinician computer or the healthcare system, okay, where we can follow what is going on. And even we can combine all data coming from the sugar level, from their steps, heart rate, oxygen saturation, all of this can be combined in one chart, as you can see. So every day during Ramadan and Shawwal, we're following their steps objectively and remotely from our clinic by checking their steps and make sure that they're like here, they are reaching the target steps. And this is a chart in a bigger view, which will combine all this together. And this chart can be used by artificial intelligence later on to make a prediction models that can help the decision making later on for patients like that. This type of studies, it is using the artificial intelligence that help us to move from the traditional form of trials to the hybrid decentralized trials, where part of this trial can be done from home and part in the hospital, like initial visit for education or at the end of the study to deliver back the devices like that. The primary outcome of the study was to assess the difference in percentage time below range, below 70 milligram per deciliter during Ramadan fasting, and in the month after Ramadan, which is Shawwal in non-fasting state, in others with type 1 diabetes using the Minimus 780G, and they are doing moderate intensity exercise. Main secondary outcomes, the difference between Ramadan and Shawwal in time in range, time above range, level 2, time below range, which is a significant one, less than 54 milligram per deciliter, also to compare variability. Also, we conducted the satisfaction questionnaire, diabetes treatment satisfaction questionnaire at baseline after Ramadan and after Shawwal. And also, we plan to get artificial intelligence techniques for prediction of outcomes based on the data we got. Other secondary outcomes, mainly we will review the advanced hybrid closed loop system settings. There are 3 components in the system. The doctor will work on them to adjust for adjustment for better control, the insulin to capacity ratio, active insulin time, and the automated glucose target. So we'll see any difference between baseline, Ramadan, and Shawwal. Also, we'll compare the metabolic parameters, and we'll see if there is any DKA or hypoglycemia developed. We conducted baseline data and laboratory. We follow up with every 10 days during Ramadan and Shawwal. It mainly remote visits, unless initially, of course, after Ramadan for lab and after Shawwal for lab, these were face-to-face. And we conducted lab after Ramadan and after Shawwal. We recruited 43 patients. 6 of them changed their mind at the onset before starting Ramadan immediately, so they were excluded. And one of them also became pregnant before Ramadan immediately, so we were excluded here also. So we completed the study with 35 patients. This is their baseline data. 19 were females, aged like 28 on average, diabetes for 16 years, BMI of 29, A1C 7.8, time range 64%, time below range 1.8, above range 35%, variability 36. The compliance to fasting was high, it was 90.5, and on average, the patients were able to fast 26.2 days out of the 29 days of last Ramadan. And 11 patients of them, so 1/3 of them, were able to fast Ramadan completely. The compliance to exercise were in Ramadan 84.4% and in Shawwal 88%, and no severe hypoglycemia or DKA episodes were reported. Regarding the primary outcomes, the time below range, to show safety, there was no significant difference between Ramadan and Shawwal, as you can see. So it is non-inferior to Shawwal, and this is proof safety of exercise and fasting using the 780G. Regarding main secondary outcomes, time and range, it was significantly better in Ramadan. Time above range, it was significantly better in Ramadan. It was less in Ramadan, so it is better in Ramadan. The significant hypoglycemia level 2 less than 54, there was no difference, and in general, it was very minimal. Regarding variability, no difference between Ramadan and Shawwal. So in summary, the main outcome, no difference, so it is safe. Regarding other levels, it was significant in favor of Ramadan regarding time in range, time above range, and the level 1 hyperglycemia time above range. All of these were significant in Ramadan. Regarding metabolic parameters, A1C and other metabolic parameters, no difference between Ramadan and Shawwal. Regarding insulin requirements, baseline after during Ramadan and Shawwal, no difference at all in insulin requirements. Regarding the system settings, I have said this is the 3 components that we work with as clinicians on them to adjust the system. As you can see, between our baseline Ramadan and Shawwal, no difference at all in carb ratio, insulin carbohydrate ratio, no difference in active insulin time. But the smart glucose target, some patients require to relax the target slightly from 100 to 110 during Ramadan. And there were only 7 cases, which constitute like 20% of the patients, only required during first follow-up to relax their target from 100 to 110. And as Oster said, the good physician treats the disease, but great physician treats the patient who has the disease. So we conducted satisfaction questionnaire in Arabic, in Qatari Arabic accent. It is already validated in the Qatari accent. And as you can see, there was no difference between baseline Ramadan and Shawwal in satisfaction. And anyway, it was very high score, even at baseline before conducting the study. Also, regarding perception of hyperglycemia, there was no difference. And regarding the perception of hypoglycemia, also no difference between Ramadan and Shawwal. So in conclusion, others with type 1 diabetes using Minimed 780G, advanced hyperglucose system, and fasting in Ramadan can safely do moderate intensity exercise during the eating hours, and time below range only 1.8%, with no significant difference between Ramadan and Shawwal. Patients had significantly better control based on time range and reduced hyperglycemia. Very important point, the flexibility about using this system. As I showed, we didn't need to change the setting of the system from baseline to Ramadan to Shawwal in all cases, except only 7 cases, which 20%. We really need to relax it, only the target slightly from 100 to 110. So if you have patient who are interested in exercise during Ramadan and fasting, you may do this after follow-up, after initial few days of Ramadan, not before Ramadan. After initial few days, if the patient required to relax his target to avoid hypoglycemia, you can relax the target slightly like that. And patients showed great satisfaction with this system from baseline during the 2 phases of the study also. This study was funded by Medical Research Center and Hamad Medical Corporation in Qatar, and I would like to thank our team from Technology Unit in Hamad Hospital, the clinicians, and also our collaborators from Artificial Intelligence Center for Precision Health at Royal Cornell Medicine, Qatar. Ramadan Kareem, and thank you.